I am now pleased to welcome Representative Cervania to go into further detail on affordability.
Thank you, Representative Crawford, for that great introduction and the needs of Medicaid and every healthcare need in North Carolina. I am here today as one of your representatives. My name is Maria Cervania, and I proudly serve the District of 41, but everyone in North Carolina. I'm going to share a story here in the Triangle. We are blessed with access to excellent research universities, medical schools, and world-class healthcare. But North Carolina is a diverse state, and the experience with healthcare access and cost is not uniform across all 100 counties and over 500 municipalities. Our caucus believes that the legislature needs to be paying attention to healthcare affordability and not kicking the can down the road in hopes that things will just sort themselves out eventually one day. Healthcare is something we all need and don't have a choice about whether we want it or not. It's often literally a matter of life and death. Yet, as Representative Crawford mentioned earlier, the majority treats healthcare too often as a luxury. The struggles of ordinary families, regular families with limited means to pay for their medical bills are given limited attention in this building in Raleigh. Premiums are high, deductibles are high, out-of-pocket fees and costs are high and only getting higher. Billing is confusing and opaque, and in many parts of our state, the healthcare market does not give consumers enough real choice. The Affordability in Healthcare Act is designed to confront these problems directly. First, it creates a low-cost health plan that can be offered on the federal exchange. Right now, nearly 1 million North Carolinians buy their health insurance off the exchange, even with subsidies, which are being attacked at the federal level. The cost can be prohibitive, and the cost of health care, like I mentioned earlier, are rising every day in this very year. Our bill would authorize DHHS to contract with an insurance vendor to process claims under a low-cost health plan to provide more options. And we can provide premiums that can serve hundreds of families and save hundreds of dollars a year and make federal subsidies go even further. This is especially important at these times when subsidies are volatile at the federal level and every dollar counts. The purpose is straightforward: prevent exploitation, expand flexibility of choice, increase competition, and create a more affordable coverage option for people buying insurance on the individual market. If people want greater coverage and can pay a higher premium, they should. But for the estimated 1 million North Carolinians who can't afford health coverage at all, with the option that they are out there already, this is a lifeline. Like I said, this could be life or death. If North Carolinians can't afford health care, they can't seek life-saving treatments until, and in many cases, it's too late. Adding 1 million people back into a healthcare system would not only make North Carolina healthier, but also stabilize our struggling rural hospitals where many residents simply can't afford the limited health care that they can access. The bill also creates a public health purchasing consortium. Between North Carolina's various state health plans, the state commands healthcare purchasing at an enormous scale, nearly 4 million people. But too often that purchasing power is fragmented. And if we align and consolidate our negotiating leverage, we can negotiate down the cost of healthcare in the millions and get better value for our people. And we shouldn't wait until illnesses become so severe that they need catastrophic interventions. If our residents are healthier and can avoid chronic diseases, they can save more on their bills and reduce long time waiting times for healthcare. We know that housing, nutrition, transportation, and safety can drive health outcomes and cost. This proposal continues to expand and the work of the Healthy Opportunities program by alleviating the risk for conditions like diabetes, cardiovascular disease, and asthma. This bill also increases transparency on billing, protect a competitive health care market, and create rural health care protections. Our ultimate goal must always be to make sure the system works for all patients. As I said before, but we'll say it again, healthcare is not a luxury. It is a basic and fundamental necessity. If we want North Carolinians to seek treatment and preventive care early, stay healthy, avoid medical debt, and remain in the workforce, then affordability has to be treated as a serious policy objective, which is exactly what this bill and the rest of our bills do. Thank you, and I will turn it over to Representative Ball.